Hi everyone, my name is Danilo Comminiello from Sapienza University of Rome, that you can see as my background. The work I'm going to introduce is entitled A Wide Multimodal Dense Unit for Fast Magnetic Resonance Imaging. And it is authored by Antonio Falvo, me Danilo Comminiello, Simone Scardapane, Michele Scarpiniti, and Aurelio Uncini. In this work, we propose a deep learning method that accelerates magnetic resonance imaging through the reconstruction of undersampled MR images. First, we introduce the motivation of this work and we explain why it is important to accelerate MRI analysis. We present our approach and describe the general framework that we consider to reconstruct undersampled images. Then we describe the architecture of the proposed wide multimodal dense UNET that is able to exploit the joint information deriving from the combination of different types of images. Then we evaluate the proposed architecture for the reconstruction of MRI images related to patients affected by multiple sclerosis. Experimental results will show the performance improvement of the proposed method with respect to existing models in reconstructing images with an acceleration of 4 times. The acceleration of MRI analysis has become an attractive research topic in the last years due to its potential advantages, such higher availability of MRI scanner and lower healthcare costs for patients. To accelerate MRI, we must consider that the MRI process needs to sample as much spatial frequencies as possible in the K-space to obtain detailed and high-quality images. One possibility to reduce the scanning time is to capture a few K-space lines and reconstruct the undersampled image. In recent times, the acceleration of MRI has been addressed by using deep learning methods which have shown significant capabilities in reconstructing undersampled MRI images. However, most of the existing methods focus on the reconstruction of MRIs using unimodal neural architecture with an undersampled images as input. In this work, we want to improve the reconstructed MRI image by exploiting the joint information provided by different kinds of input. To this end, we propose a multimodal deep learning method that is able to reconstruct undersampled MRIs obtained by reducing the K-space data to provide a high image quality that can be used to observe certain areas of interest. The multimodal approach is motivated by the fact that some medical diagnoses often require the analysis of different kinds of MR images to be accurate. One of the most significant examples is represented by the multiple sclerosis diagnosis that is often based on the analysis of the conventional MR sequences, like the T1 weighted and the T2 weighted images, and also of particular sequences such as FLAIR and DIR, which allow to stand out the lesions due to the disease. FLAIR images in particular are widely used in MRI diagnosis as they allow to enhance the brain lesions due to the disease. FLAIR sequences are highly correlated with the T2 WI, thus their joint use increases the efficiency of the reconstruction and also presents much more information in the lesion region, which will have different characteristics depending on whether they are reserved or not, for instance. To this end, we propose a multimodal deep learning approach which aims at reconstructing T2 weighted images by exploiting additional information provided by FLAIR images to better detect the MR lesions. Compared with the existing methods, the new model processes 2 input images, the T2 weighted image and the FLAIR sequence, separately in the contracting path in order to exploit the correlation between images of the same kind and optimize the information extraction. Moreover, the new architecture involves a new dense block that does not increase the computational complexity of the overall network. We assess the reconstruction performance of the proposed method, considering an acceleration factor of 4 times of the MRI analysis. We focus now on the general reconstruction framework in which we developed our model. The figure shows the framework implementing the adopted strategy for the reconstruction of undersampled MR images. The fully sampled image, WT2, represents the reconstruction target for the T2 weighted image. We transform the fully sampled image into the k-space domain of spatial frequencies by applying a 2D Fourier transform, obtaining XT2. Then we undersample the XT2 by using a masking transform and obtain XT2U. This is done for simulation, but we can imagine that a scanner may directly provide this kind of undersampled images. Anti-transforming XT2U, we obtain the undersampled T2 weighted image, which is denoted as YT2U, that is used as input to the proposed deep neural network model that we're going to present, thus yielding the reconstructed T2 weighted image that is denoted as WT2R. One of the most critical processes in the described framework involves the choice of the undersampling strategy that allows to achieve the undersampled image in the k-space domain. It affects significantly the quality of the reconstruction. Our undersampling strategy aims at preserving as much as possible the information contained in the k-space of the target image. It allows to concentrate most of the available samples in the central area of the k-space, where the low frequencies components responsible for the image contrast information reside. The rest of samples are distributed in an equidistant manner in the high frequency areas. So in classic undersampling strategies that we can see on the left, we can see that they focus on the center of the k-space, which is the area containing about the 95% of the total spectral power and which guarantees the condition of separability. In our approach on the right, we consider the 80% of total samples from the center and the remaining in an equidistant manner, so in order to have information even in the high frequencies. We introduce now the proposed neural architecture that is used in the framework to achieve the reconstruction image. As previously said, we adopt a multimodal approach because in the MRI analysis for multiple sclerosis disease, useful information can be obtained by using different types of sequences. In particular, we focus on the T2 weighted images as input to be reconstructed, but we also include in the input the flare sequences, which provide further information to stand out brain lesions. The proposed network contains 4 kinds of components, namely convolutive layers, pooling layers, deconvolutive layers, and dense block. The size of the characteristic map decreases along the contraction path through the pooling blocks as it increases along the expansion path by the convolution. With respect to the classic multimodal dense UNet, the new architecture receives 2 kinds of images as input separately, each of which is subtracted to a pooling process. Pooling returns the maximum value of each partition of the input image. Its purpose is to progressively reduce the size of the representations and avoiding any overfitting. The expanding path begins after the 3rd pooling level, in which we have a sequence of deconvolutive levels which allow to obtain an incremental recovering of the original size. The convolutive layers act inversely with respect to the pooling and aim to increase the spatial dimensions of the input. The dense block allows to effectively increase the depth of the entire network while maintaining a low complexity. The dense block of the considered multimodal architecture consists of 3 consecutive steps: batch normalization, activation function, and 3x3 convolution filters. In particular, the proposed dense block is characterized by parametric rectified linear unit activation functions, which attempt to solve the problem of neuron deactivation of the classic ReLU. The hyperparameters of the dense block are the growth rate and the number of convolutional layers. In particular, we set a null growth rate for each layer and a number of 4 convolutional layers. The proposed W-MDU is based on the minimization of the following loss function, which involves the mean square error and the structural dissimilarity index. Both the terms compare the reference fully sampled image and the reconstructed one. The structural dissimilarity index is complementary to the structural similarity index, which is often adopted to assess the perceived quality of image, and it is defined based on the mean values and variance of the images. We consider a dataset containing MRIs of 30 patients suffering from multiple sclerosis disease, including T2W images and FLAIR images, among others. We have also performed a further preprocessing to extract slices of size 192 times 292. Undersampled T2WIs were created according to the proposed custom mask, so the proposed undersampling strategy, with an undersampling factor of 4. Here is some implementation detail. For each patient, we provide the network with 150 FLAIR and T2 weighted undersampled images using the fully sampled T2 weighted image as target. For the dense block, we set a null growth rate. We use the Adam optimizer for training, and we run the network for 100 epochs, also using an early stopping with respect to the validation loss. We evaluate the effectiveness of the proposed W-MDU network by comparing the reconstruction quality of the T2 weighted images yielded by the proposed method with those achieved by the standard dense UNet and the multimodal dense UNet. All the results are achieved by using the proposed custom mask as undersampling approach. In particular, using an acceleration factor of 4, the MDU is able to outperform the dense UNet, as it is possible to see from the table. The dense UNet gets the 86% of the reconstruction percentage compared to the target. The multimodal dense UNet is able to outperform the dense UNet and achieve an improvement of the SIM up to the 92%. The similarity index is improved at the expenses of the mean square error in this case, which is slightly decreased. Finally, the proposed wide multimodal dense UNet exploits the new network architecture and provides an improvement of the mean square error with respect both to the dense UNet and the multimodal dense UNet. Moreover, the proposed method also achieves an accuracy of the reconstruction up to the 95%, thus outperforming both the previous networks. Here we provide an example of the image reconstruction by using the proposed W-MDU. On the paper, you can find also other examples in comparison with the standard dense UNet and multimodal dense UNet. To conclude, in this work, we proposed a neural model based on the UNet network, which is able to exploit the potential of the multimodal approach using a new separate scheme for the initial pooling. Our approach allows to reconstruct T2WIs undersampled by a factor of 4, exploiting the correlation that exists with FLAIR images. A high quality of image reconstruction is preserved, making possible to easily stand out the brain lesion due to the MS disease. Further works will involve network improvements to enhance the reconstructed accuracy, even using higher acceleration factors. Here is a short list of references, but you can find the complete list on the paper. Thank you for your attention. Please feel free to forward any question to my email address, and I will respond as soon as possible.